If you've ever noticed that every year during certain months you start sneezing more, develop a runny or blocked nose, itchy eyes, or feel unusually tired, this video is for you. In India, seasonal allergies affect millions of people, yet many mistake them for a common cold, viral infections, sinus problems, or even more serious illnesses. Because the symptoms often look similar, people delay proper diagnosis and continue to suffer unnecessarily. In today's video, we'll help you understand what seasonal allergies are, why they're so common in India, and the most common symptoms, from mild warning signs to symptoms that should not be ignored. Before we begin, if you find health education like this helpful, subscribe to the Sparsh Diagnostic Centre YouTube channel. We regularly share reliable, doctor-guided information to help you make informed decisions about your health. Let's start by understanding seasonal allergies from a medical perspective. Seasonal allergies, also called seasonal allergic rhinitis or hay fever, occur when your immune system overreacts to particles in the air during specific seasons. In India, the most common triggers include pollen from trees, grass, and weeds, dust and construction particles, mold spores, especially during monsoon, air pollution, which worsens allergic reactions. Your body mistakenly treats these harmless particles as threats and releases histamine, leading to allergy symptoms. Seasonal allergies are especially common in India because of long pollen seasons due to tropical climate, high pollution levels in many cities, rapid urban construction, monsoon humidity, encouraging mold growth, dust exposure, even indoors. Different regions experience peak allergies at different times, but symptoms are often recurrent every year. Let's break down the symptoms by body system. Nose and nasal symptoms. These are the most common signs. Frequent sneezing, especially in the morning. Runny nose with clear, watery discharge. Blocked or stuffy nose. Itching inside the nose. Postnasal drip, mucus dripping down the throat. Unlike a cold, there's no fever. Nasal discharge is usually clear, not yellow or green. Eye symptoms. Seasonal allergies often affect the eyes, a condition known as allergic conjunctivitis. Common signs include itchy eyes, redness, watery eyes, swelling around the eyes, sensitivity to light. People often rub their eyes, which worsens inflammation. Throat and ear symptoms. Many patients don't realize allergies can affect the throat and ears. Symptoms may include itchy or scratchy throat, frequent throat clearing, dry cough, especially at night, mild ear fullness or popping sensation. This happens due to postnasal drip irritating the throat. Breathing and chest symptoms. In some individuals, especially those with asthma, seasonal allergies can trigger wheezing, shortness of breath, chest tightness, increased asthma attacks. This is called allergic asthma, and it requires proper medical evaluation. Skin symptoms. Although less common, allergies can affect the skin with symptoms such as itchy skin, rashes or hives, worsening of eczema, dry, inflamed patches. Airborne allergens can trigger skin reactions, especially in sensitive individuals. General and whole body symptoms. Seasonal allergies can also cause fatigue and tiredness, poor sleep due to blocked nose, difficulty concentrating, headaches or sinus pressure. These symptoms are often mistaken for stress or weakness. Many people confuse seasonal allergies with a common cold or infection because the symptoms can look very similar. But there are a few important differences your body gives you. First, fever. With seasonal allergies, fever is usually absent. A common cold or infection, however, may come with a mild fever. Next, look at your nasal discharge. In allergies, it is typically clear and watery. In a cold or infection, the mucus often becomes thick, yellow, or green. Now, notice itching. Itching of the nose, eyes, or throat is very common in allergies, but it is rare in a common cold. Another key difference is how long symptoms last. Seasonal allergies can continue for weeks or even months, while a common cold usually resolves within 5 to 7 days. And finally, timing. Seasonal allergies tend to occur around the same season every year, whereas colds and infections appear randomly. So, if your symptoms return every year at the same time, it's more likely that allergies, not an infection, are the cause. Understanding this difference helps you seek the right treatment at the right time. You should seek medical advice if symptoms last more than 2 weeks. Breathing becomes difficult. Sleep is disturbed regularly. Symptoms interfere with work or daily life. Over-the-counter medicines don't help. Proper testing helps identify the exact allergen, ensuring targeted treatment. Seasonal allergies are common, but they are manageable with the right diagnosis and care. At Sparsh Diagnostic Centre, we offer allergy-related blood tests, respiratory evaluations, expert guidance for accurate diagnosis. If you or a loved one experience recurring allergy symptoms, don't ignore them. Visit Sparsh Diagnostic Centre or consult your doctor early. Early diagnosis leads to better relief and quality of life. If you found this video helpful, like, share, and subscribe for more trusted health education. Stay healthy and breathe easy.